Morning to all the respected dignitaries, invitees, organizers, students, everyone, ladies and gentlemen. I, Namrata, on behalf of the Manipur University Student Union, AOI Babina Specialty Hospital and Health Center, Manipur University, warmly welcome all of you on this meaningful function, one-day academic discourse on breast cancer. In this century of the speedy development and the drastic social changes, cancer scenario has also changed. Unknowingly, the breast cancer has become the #1 cancer in the female. So it is such an important topic which we need to be study, analyze, and aware. Ngasigi thauram masigi Chief Guest, Guest of Honor, amasung President gi Fampham lengsimbigedaba ikai khumnajariba dignitaries respected Professor and Lokendra Singh, Honorable Vice Chancellor, Manipur University, Professor M. Premjit Singh, Dean of Student Welfare, Manipur University, Dr. Lamabam Pinky, Medical Officer, Health Center, Manipur University, Dr. Dhanavir Thangzam, Consultant Surgical Oncology, AOI Babina Specialty Hospital, amasung Toksom Sonamani Singh, President, Manipur University Student Union 2022-2023. Now I consider this a great honor to welcome our chief guest of today's function, respected Professor and Lokendra Singh, Honorable Vice Chancellor, Manipur University on the stage. Next, may I invite our guest of honor of today's function, respected Professor M. Premjit Singh, Dean of Student Welfare, Manipur University. Now, may I invite respected Dr. Lamabam Pinky, Medical Officer, Health Center, Manipur University, and respected Dr. Dhanavir Thangzam, Consultant, Surgical Oncology, AOI. Now, I would like to call our President of today's function, Toksom Sonamani Singh, President, Manipur University Student Union, 2022-2023. After all the dignitaries take their chair, may I request the volunteer to honor our dignitaries with the traditional lingyan and bass. Ikai khumnajariba dignitariesingna phampham lengsing birkheba matungda ikai khumnajariba dignitariesinggi maphamda lengyal khudol tambinabagidmakta volunteersinggi maphamda ningsingjari. Ikai khumnajari Ikai khumnajariba dignitariesinggi maphamda volunteersingna lengyan khudol tambiri. Thagachari volunteersingbu. Now we will have the candle lighting ceremony. To mark the openings of today's ceremony, to do the honor, may I request the chief guest to take the leads and light the candle, followed by guests of honors and president. Lights play an important part in one life. Lighting of candles means bringing people together for a better purposes. Without light, we will have the brightness of education. Not only this, but also the activities of every living being would be off. Light has made human travel speedily towards civilization and development. Once again, thank you very much, dignitaries. Ngasigi thauram masigi welcome address amasung keynote address pibinabagidamagta KSH Oken Singh, Finance Secretary, Manipur University Student Union, Budai Sadako Kachari.
A very good morning to one and all present here. Today, on this auspicious day, the 6th of October 2023, at this prestigious hall, the VC Court Hall, MUSU, Manipur University Students Union, is organizing a one-day academic discourse on breast cancer. To be a very important part of this function, when we invited Isagi Sinbakya Kaitokpiduna, VC Court Hall Asida, Sinjariba, one-day academic discourse on breast cancer, Sibu, Yabo Lakpiriba, Amasung, Sigi, Sibgeski from Pumlang, the Nation Biriba, Mingoina Panjarabada, Oza Professor N. Lokendra Singh, Honorable Vice Chancellor, Manipur University, Bu, since the Langjariba, Manipur University Students Union, Imake Degi, Taram Nokchari, Nishubada, and she guest of honor from Pumlang, the Nation Biriba, Professor M. Premjit Singh, Dean of Students Welfare, Manipur University, Busu, since the Langjariba, Manipur University Students Union, Imake Degi, Taram Nokchari, Duga. Mathangda Dr. Lamabam Pinky, Medical Officer, Health Center, Manipur University, Busu, Sinjalangjari, Bamusugi Maike, Taram Nokpagi Waro, the Pijari, Duga Mathangda, Dr. Denver Tangzam, Consultant Surgical Oncology, AOI, Busu, Sigi, Sinjalangjari, Musugi Maike, Taram Nokchari, Duga, Sigi, President from Humlang, the Lengshin Biriba, Dr. Sonamani Singh, President. Manipur University Students Union 2022-23 Busu Sinjalangjariba Musugi Maike de Gitaram Okchari. Ngase Musuna one day academic discourse on breast cancer. Sinjaribagi Maram Thoidokna Hena Visualizade Dubu Ngase Malemge Hana Layenge Amusung Health Ki Oirakliba Hongakliba Mong Matosing Asida Mususu Ngasigi Health Services ta Adugumlaba Kut Karating Toko Matautai na Kanjarubuda ngasi aikogi irakta maleng miyamda kahena nariba kahena miyoibna thengnabada wariba amasung matam chana yenghaudragadi miyoibagi punchi fawba lawba yariba amasung matam chana fawragadi yenghaudragadi diagnose tawbi hauragadi treatment tawbi hauragadi koina kanwa fawba yariba dugumlaba laina singi marakta breast cancer asisu yamna adumak maru oiba laina singi manungda chali haibudu musuna fawjai maram aduna ngasimak Shigi Ferba Numit Asida, Manipur University Students Union na Hariba Academic Discourse Asibu Sinjalangjan and Nabagam Warabadu Loja Kibani, Dana, Nashigi, Tinbiriba, Holisida, Langbirakliba, Daiski, member Obiriba, Mangdi Langsin Biriba, Jasing, Aduga, Tongan Department, the Giling Birakliba, Nuxizaraba Satrasing, Aduga, Tokaiba, Mopandaki Ling Birakliba, Healthcare Services, the Liberiba, Chilnauxing, Media Person Sing. Sinjalangjariba Musugi Maike de Taram Nokchabuga Loinana, Nasi Makasa Terakadoriba, Muru Oiraba, Resource Person Sing, Amasung, Medical Officer Chingba, Mui Singdagi, Tamnakadoriba World Sing Adu, Puning Tawai Haksang Yang Tamin Nabagaloina, Nasi Sinjariba Academic Discourse Asigi, Nungi Oiba Hanto, Adushu Kangminaraga, Nasigi program Asi, Yauba Mapung Fab, the Odongi, Asawa Daita Dusu Lobi Haibuga Loinana, Ashi Aigi, welcome address Biba, Matang Silo Sinjari, Takachari.
Thagachari Ketrameo Okin, Finance Secretary, Manipur University Student Union Bu. In relation with this function, Manipur University Student Union would like to present a token of appreciation to respected Mr. Manas Majumdar, Facility Director, AOI Babina Specialty Hospital. To do the honor, may I request Halishan Ngatim, Social and Culture Secretary. May I invite Ketrameo Oken, Finance Secretary, to do the honor? Next, we would like to present a token of appreciation to Gopen Trongbam, Marketing Manager, AOI Babina Specialty Hospital. Due to the honor, may I request Oken, Finance Secretary, Manipur University Student Union. Now, may I invite Dr. Danabi Thangzam to deliver the speech and presentation, who is the Consultant Surgical Oncology AOI Babina Specialty Hospital. Now may I invite respected Professor and Lokendra Singh, Honorable Vice Chancellor, Manipur University, to deliver a speech.
Professor Premjit Singh, Dean Students Welfare, Manipur University. Dr. Dhanabe Thangzam, Consultant Surgical Oncology, American Oncology Institute. Dr. Lamabam Pinky, Medical Officer of the University Health Center. Sri Thokchom Sanamani Singh, President of the University Student Union. Dr. Mazumdar, the Director of the American Oncology Institute. Members and office bearers of Manipur University Student Union. Learned faculties, distinguished invitees, friends from the media, and ladies and gentlemen. First, let me take this opportunity to congratulate the organizers, the team of Manipur University Student Union, for organizing this awareness program, one-day academic discourse on breast cancer. University, actually, it is a very expanding university now. We have altogether around 6,900 students registered in the university. Out of the 6,000, around 900 students, approximately 1,500, they are registered as residents in different hostels of boys and girls in the university. Plus, we have a good number of, residents, non-teaching as well as teaching, who are staying in the university faculty, in the university, say, campus. Around 180 to 200, they are staying in different quarters of the university campus. Plus, our university is being surrounded by a number of very thickly, populated, areas and localities in different directions. And the health hazard is one of the major issues that a border state like Manipur has been facing for quite some time. I must also thank the medical officer, Dr. Lamabam Pinky, because so far, during the COVID time, university had organized a number of COVID awareness program, plus COVID intervention program, and off and on, Dr. Pinky and the other associates have been organizing blood donation camp, eye camp, dental camp, and so many other camps. And it's a pleasant surprise for me that today the student union has very successfully and very nicely organized this awareness campaign on the breast cancer, which is actually a hidden but ever expanding problem of people in Manipur, both in the hills and the plain areas. Northeast India has for a long time been, some kind of cancer capital, because Northeast Indian people normally they used to consume a lot of smoked meat and smoked fish. And as for Manipur, particularly in the plain areas, every meal, invariably there used to be some form of, fish, either in chutney or in soup or in vegetable curry and all that. Without fish, without any form of fish item, none of the meal, either lunch or dinner, is complete. And normally, people feel that any meal without fish is, they consider it as no meal. But the trouble is that for a long time, many of our people in disguised form, they used to go to Tata Memorial Hospital. I have not visited that place, but I am told that there are residential quarters in and around Bombay, particularly for patients from Northeast India. And it's very encouraging, and it's a matter of great pride and a privilege for people of Manipur that recently the American Oncological Institute has come up. And this American Oncological Institute will certainly provide some kind of relief to all the people, not only in Manipur, but also for the neighboring states like Nagaland or Mizoram. Assam, of course, is quite different because Assam has got their own oncological and cancer research institute. And Assam actually is the metropole of the entire Northeast India. Everyone from Northeast who wants to go out of, say, Northeast, they have to, pass through Assam. So Assam is the metropole of Northeast India, and therefore there is no problem. But many other landlocked states, including even Tripura, Mizoram, Manipur, Nagaland, these are some of the areas which are very much cancer prone. And many people, in fact, one of my own students who was working under my supervision for PhD programs is no more. She did not tell me that she was having this problem. She always used to say that she cannot complete writing her thesis because of health problem. But breast cancer is one issue which actually lies hidden, because of so many other social and ethical issues. People normally do not speak out. I have got 3 daughters. I'm very particular about this particular disease. I keep telling my missus that, you must take particular, initiative in order to see that none of our children are affected. Even if they are affected, it should be diagnosed in time, because cancer, when the pain of cancer starts, that is almost a stage in which, that patient has reached an incurable stage. The moment you are suspicious of any kind of, some kind of abnormal changes that you see in any part of your body, I'm particularly telling my girl students, when you see any part of your body there is some abnormal growth, you must immediately inform your parents, and you must go to the concerned say specialists and the doctors. That's the only way to detect say breast cancer, because normally people used to take the early stage of breast cancer is nothing but some kind of a boil or some kind of a swelling up and things like that. But it's not good. Self-treatment is not, we cannot encourage self-treatment, and we cannot live in a world of superstitions and quacks. Because now it's a very scientific world, it's a very developed world. Manipur has got so much of facilities. The moment you are suspicious, the moment you feel that there is certain abnormality in your body, you must immediately inform your parents, and you must go to the concerned specialist and rule out any kind of, say malignant, say swelling up in your body. And therefore, Manipur now, I think, of all the states in Northeast India, Manipur is now the cancer capital. There's varieties of cancer, abdominal cancer, intestinal, this bowel cancer, because these are all because of the drastic changes in the food habits. For a long time, people used to be addicted to, what do you call, zarda pan. Nowadays, of course, things have been cut down. For quite some time, people were addicted to cigarettes, then this, nicotine use, then, so much of mental tension and the stress and the strain. For decades, people in Manipur have been undergoing this undefined stress and the strain in some form or the other, because ethnic problem has been there, the problem of insurgency has been there, youth unrest has been there, problem of unemployment has been there. All these things are visibly or invisibly or consciously or unconsciously, human beings are absorbing it. They are absorbing it in the form of, ideas in your mind, in your brain, or all these tensions are being directly or indirectly impacting on your physiological and the body system. And therefore, now we are living in a very scientific and a modern world. We should no longer live in the world of quacks and superstitions. We must be very scientific now in our approach. All of you now are having your, say, Google Master. You know what's happening in different parts of the world. We are now linked up to different parts of the world with the Google Master. So therefore, it's no problem for us. Nowadays, students, even if they go out of the state for treatment, they can fix the appointment even from Imphal itself. Even if you want to go to Apollo Hospital or this hospital or say that hospital, you can plan your journey and the traveling by fixing your pre-appointment even from Imphal itself. And therefore, I'm extremely pleased and I'm very happy to see that this program is being organized in the larger interest of the girl students of Manipur University. Probably this is the first on breast cancer, and I hope the American Oncological Institute will keep supporting the university, because Manipur University is a very, very expanding university, and there are more girl students than the male students, both in different departments as well as in the hospitals. So therefore, and I would also like to say that since the American Oncological Institute has come up, university may be interested in the near future. Dr. Mazumdar is here to have some kind of a tie-up with the university in the larger interest of our students in particular, and patients and other people near the university in general. With these few words, I want to thank all of you once again, and I would have loved to be with you. I want to see this say demonstration and a presentation by say, Dr. Dhanbir. His father was a very senior, at one time was a very senior professor in the Department of Life Science. I would have loved it, but for some other commitments, I have an online meeting, so I would come back after that meeting. Okay, thanks a lot.
Being a biochemistry student in this university, we love to see the collaboration between the Manipur University and the AOI Babina Specialty Hospital. And so it is indeed true that Manipur University Health Center has done such a appreciated role in the COVID-8 times and as well as today. And thank you very much for reminding us that health is well and we should never be careless regarding our health matter. Next, may I invite Professor M. Premjit Singh, Dean of Student Welfare, Manipur University, to deliver a speech.
Good morning, everybody. Respected Chief Guest, Professor N. Lokendra Singh, Honorable Vice Chancellor, Manipur University, who have just left due to some urgent work. Dr. Lamabam Pikki, Medical Officer, Health Center, MU, the guest of honor of this function. Dr. Dhanbir Thangjam, Consultant Surgical Oncology, American Oncology Institute. Dr. Mazumdar, Director, American Oncology Institute. Sri Thokcham Sonamani Singh, President, MUSU. Members of the MUSU, my dear colleagues, members of the media, and my dear students. It's my pleasure to be a part of such an awareness program being held in Manipur University by MUSU in collaboration with AOI. About the technical things of the breast cancer, I think it will be explained by the experts later on. What I want to express is from the viewpoint of a layman for whom someone might have been affected, may not be breast cancer, but by some kind of cancer. Actually, in our Manipur, there are so many facilities, medical facilities. But I think in the past, about the cancer, the facility was not that good. For any disease to be diagnosed or to be to be attended, the most crucial part is detection. But to detect whether somebody has been affected with cancer or not, it's very, very crucial. I'm just telling you the story of one of my relatives who was diagnosed by one of our hospitals in the Manipur that she has been affected with cancer and she was advised to do chemotherapy. At that time, we thought that it's better to discuss or better to consult with, say, some other doctor, or it's better to take some second opinion. Then we had decided to go to Tata Memorial Hospital. There, They conducted tests for I think around 1.5 months. Then they diagnosed that it is some kind of abnormal growth of cells, but not actually a cancer. At that time, we felt so happy as if she has got a second life. What I want to say is early detection and proper detection is very, very crucial. And without this, that disease or that patient might have been treated in the wrong way, and it will affect the health of the patient drastically. But nowadays, by the coming of American Oncology Institute and some cancer hospital by Babina, I think early detections will not be a problem for the people in Manipur. But as our Honorable Vice Chancellor has suggested, if there is some MOU with the hospital or that in AOI, I think our lady students will get the chance, girl students will get the chance, if they have some doubt about this disease, to get detected early. And with these few words, I hope and I wish this discourse a success, and thank you all.
Thank you very much, respected Sir Professor M. Premjit Singh, Dean of Student Welfare, Manipur University. Next, may I invite Dr. Lamabam Pinky, Medical Officer, Health Center, Manipur University, to deliver a speech.
Good morning, everyone. I would like to welcome Chief Guest Professor N. Lokendra Singh, and I would also like to welcome our guest of honor, Professor M. Premjit Singh, Dean Student of Welfare, MU. Next, I would like to welcome guest of honor, Dr. Dhanavi Thangjam, Consultant Surgical Oncology, AOI. And I also like to welcome President Thokcham Sonamni Singh, President MUSU 2022-23. I also welcome all the dignitaries, faculty members, invitees, students, scholars, and media person. It's a great privilege to have Dr. Dhanavi Thangjam to say about one-day academic disclosure on breast cancer that aims to increase awareness and reduce the stigma linked to the symptoms and the treatment of the breast cancer. At last but not the least, I would have, like to have more awareness program with AOI related to not only breast cancer and other related cancer in coming days. And we'd like to jointly organize with our MUSU and AOI and Babina Special and Health Center. This much I want to say. Thank you so much. And more regarding this breast cancer, Dr. Dhanavi Thangjam will see. Thank you so much.
Thank you very much, respected Madam Dr. Lamabam Pinky, Medical Officer, Health Center, Manipur University. Now may I invite Dr. Dhanavi Thangjam, Consultant Surgical Oncology. Ngakpigani, ngasigi thawram masigi President speech pibinawidamakta Thokchom Sonamani, President Manipur University 2022-23, ibu ko khatchari.
ꯑꯍꯥꯟꯕꯃꯛꯇꯗ ꯉꯁꯤꯒꯤ ꯂꯥꯛꯄꯤꯔꯤꯕ ꯌꯨꯅꯤꯚꯔꯁꯤꯇꯤꯒꯤ ꯁ꯭ꯇꯨꯗꯦꯟꯠꯁꯤꯡꯕꯨ ꯏꯀꯥꯏ ꯈꯨꯝꯅꯕ ꯎꯠꯆꯔꯤ ꯆꯤꯐ ꯒꯦꯁꯠꯀꯤ ꯐꯝꯂꯥꯡꯗ ꯂꯦꯡꯁꯤꯟꯕꯤꯔꯤꯕ ꯄ꯭ꯔꯣꯐꯦꯁꯔ ꯑꯦꯟ ꯂꯣꯀꯦꯟꯗ꯭ꯔꯣ ꯁꯤꯡ ꯑꯣꯅꯔꯦꯕꯜ ꯚꯥꯏꯁ ꯆꯥꯟꯁꯂꯔ ꯃꯅꯤꯄꯨꯔ ꯌꯨꯅꯤꯚꯔꯁꯤꯇꯤꯕꯨ ꯏꯀꯥꯏ ꯈꯨꯝꯅꯕ ꯎꯠꯆꯔꯤ ꯑꯣꯖꯥꯁꯤ ꯊꯕꯛ ꯑꯆꯤꯟꯕ ꯑꯃ ꯂꯩꯕꯗꯒꯤ ꯆꯠꯈ꯭ꯔꯦ ꯒꯦꯁ ꯑꯣꯐ ꯑꯣꯅꯔꯒꯤ ꯐꯝꯐꯝ ꯂꯥꯡꯗ ꯂꯦꯡꯁꯤꯟꯕꯤꯔꯤꯕ ꯄ꯭ꯔꯣꯐꯦꯁꯔ ꯑꯦꯝ ꯄ꯭ꯔꯦꯝꯖꯤꯠ ꯁꯤꯡ ꯗꯤꯟ ꯑꯣꯐ ꯁ꯭ꯇꯨꯗꯦꯟꯠꯁ ꯋꯦꯜꯐꯤꯌꯔ ꯃꯅꯤꯄꯨꯔ ꯌꯨꯅꯤꯚꯔꯁꯤꯇꯤꯕꯨꯁꯨ ꯏꯀꯥꯏ ꯈꯨꯝꯅꯕ ꯎꯠꯆꯔꯤ ꯗꯥꯛꯇꯔ ꯂꯃꯥꯕꯝ ꯄꯤꯡꯀꯤ ꯃꯦꯗꯤꯀꯦꯜ ꯑꯣꯐꯤꯁꯔ ꯍꯦꯜꯊ ꯁꯦꯟꯇꯔ MUꯕꯨꯁꯨ ꯏꯀꯥꯏ ꯈꯨꯝꯅꯕ ꯎꯠꯆꯔꯤ ꯗꯥꯛꯇꯔ ꯗꯅꯕꯤꯔ ꯊꯥꯡꯖꯝ ꯀꯟꯁꯜꯇꯦꯟꯠ ꯁꯔꯖꯤꯀꯦꯜ ꯑꯣꯟꯀꯣꯂꯣꯖꯤ AOI ꯕꯨꯁꯨ ꯏꯀꯥꯏ ꯈꯨꯝꯅꯕ ꯎꯠꯆꯔꯤ ꯂꯣꯏꯅꯅ ꯉꯁꯤꯒꯤ ꯂꯥꯛꯄꯤꯔꯤꯕ ꯄ꯭ꯔꯦꯁ ꯃꯦꯗꯤꯌꯥ ꯁꯤꯡꯕꯨꯁꯨ ꯏꯀꯥꯏ ꯈꯨꯝꯅꯕ ꯎꯠꯆꯔꯤ ꯉꯁꯤꯒꯤ MUSU amadi AOI Babina Specialty Hospital amadi MUG Health Center na sinjaduna one-day academic discourse on breast cancer sida lakpiriba khwai khudingmakpu kok nonjari khoina breast cancer gi maramda ka henadi khangjade adubu cancer asi miyoi bagi punsida kanamtada nahaningdaba laina makhal amani aduna yari makhaidi cancer asi fajana hanasu detect tawbusu ngamde haide khoina nadriboidi ningaga adum kon hekta test tawraga naramba aduga oja premjina su haibigre Manipur da tsengna Manipur khudingmak doctor khudingmak ki natabida Manipur da layang matamda khoigi handak khoigi bachawama naba matamda cancer ne haraga chemo se adum pangkapta kapa aduga Chandigarh romda yengra kandana depression nabagi chamjamba guli ampiraga phagi bandaki adudana yari makhaidi phajana tanabiraga cancer ai balaina asi khoi mioiba kanamtana naning banate aduna asigi maramda khoina yam ka haina khangubusu nate si details oina lakpiriba doctor singna marik chumna takpigani na khanjai sikhar saijaraga ai saidalo simjarage
तसेंगना मक्सुनी कैंसर हाइबा लैना से कनानमतसु नानिंगबा लैना मखल नत्ते थागतचरी थोक्सुम सोनामनी प्रेसिडेंट मणिपुर यूनिवर्सिटी स्टूडेंट यूनियन 2022-2023 Now may I invite Dr. Danabi Thangzam, Consultant Surgical Oncology, AOI Babina Specialty Hospital, to deliver a speech and a presentation.
Good morning, everyone. Uh, First of all, I'd like to thank the Manipur University Student Union, Manipur University Student Union gi Satra masung member punamakpu ikok nong kurumjari. Number one, da aina local dialect just greeting amtang pisage. Manipur University campus has a very emotional bond with me. Aigi baba sida life science professor when I learned I being idol army. So there has a big bond. My father was a professor in the life science, so has an emotional touch with me. So thank you very much for inviting me here. So without much delay, I would like to start with this academic disclosure. And before that, I'd like to thank the Vice Chancellor and Dean of Student Union, Professor Premjit and Professor Loken, for being with us, and all the dignitaries and my dear students. So today I will be speaking on breast cancer awareness and screening. I am Dhanavir Thangzam. I am a consultant in surgical oncology at American Oncology Institute, Imphal. So a warm greetings from my institute. This is our institute, a beautiful institute. Please visit us. Yes, Breast Cancer Awareness Month is observed in all over the world from 1st of October to 31st of October. I'll come to this awareness program in later slide. First of all, I would like to show some of the figures in the world, why we are doing a World Breast Cancer Awareness Month for almost a month. Because this is the global scenario. Breast cancer is the most common cancer among the women. Nupi cancer number one. Kwaidagi yamna naba. Nupi marakta kwai yam naba cancer is breast cancer. About 2.3 million new cases per year. Sahi kudingi million ani gi mathakta nai. Sahi kudingi neko. Anobu neko. Hanagi yaugdabda. 25% of the cancer nemana oiris. Aduga nabadang natana, it also causes lots of mortality. Sidagi asi anayam thokpa makhangi cancer ni. Sigi fourth line da is 2008 to 2012 the incidence 20% hengale. Have the cancer masing na by 20% hengale. Aduga quite no itabana mortality to hengala 14%. Aduna chum hengale. Estimate only next 2 decades, 20 years, 60% of new cases tokani haidana, then 70% of mortality to tokoye, especially in the developing country like India. India gumada, who is Southeast Asia developing countries, like an endemic when COVID lapadona masu cancer zu burden rising trend. Aduna low middle income country, rapidly rising incidence and high mortality is a alarming situation for breast cancer. This is the world map. This is a global cancer congress 2020. So you can see breast cancer over here is around 25%. So almost half of the so this is the world map. The pink dignifies or symbolize breast cancer. So the entire world is pink. Only few areas are having less breast cancer because they are lessly populated. Sila ibag matakta like Greenland gumba. Pointer gumba like that. So I can, this one is there. So Sugumba, this place, miyam tada bazaga karakatane, but otherwise the entire world is filled with breast cancer. So this is mortality, sibai sang. First picture samtang yang si hidadi mi se loina magnai adubu breast cancer naraga sibagi sang si sakot palamdadi. This is American, then aduga Australia, Sugumadana, cancer is naragazu CD. Mortality is less. But whereas in India, Southeast Asia, the CB sanction wangi. So this is kitang kiningai oi. Then global breast cancer incidence and mortality compared to organi. First, this is Australia. I nasa hijakare moida yam 95% mukti breast cancer nai, but CB sangi only 12%. But whereas Southeast Asia low income countries, India gumadadi 40% katang nai, but mortality is the wang 15%. Adun takodi the breast cancer si na sunai sibe sang su wang maram kharlei. There are some causes maram lei adu khoyan khangminasi. So come to our lovely state Manipur. This is a report published by Indian Council of Medical Research ICMR Bangalore. The burden of cancer in northeast state of India. This is about Manipur. Aina sigi graph si kitang highlight tawning 2005 swaida lairamba cancer gi incidency koina sina sigi line sina breast ni sina cervix ni sina lungs kini yang wang na lemi lungs cancer na number 1, number 2 the cervix angang khau machin cancer, breast na number 3 adubu sum sahi 2014 hadio matam dadi breast cancer na cross tawre breast cancer na hagalakpa aduga atopa cancer na antharakpa. So the breast cancer has crossed the top. For in Manipur, the pink is for the lady and the blue is for the male. So breast cancer is the number 1 cancer in Manipur. Manipur dasu nupi marakta khwaidai naba cancer is breast cancer ni. There's almost 15% dum nai ko. Mathang the lungs cancer amasung cervix cancer. So ngasi ki program se koi breast cancer ni breast cancer da focus tawjage. So among the communities mayam lei. Urban life ta leiriba Meitei communities na 56% of cancer nabagi incidence ta khoina khoi wangi maramdi akhoi lifestyle ji kitang kena taw kitang alarming oi na khoi urban life ta leiba city da leiba Meitei na khayam le na aduna Meitei community da breast akhoi cancer oi na si only breast cancer kitana tewa sina overall cancer ki incidence Meitei da yamba hele. Then the leading site ainang sai hajakre Manipur gini si breast cancer number 1 da dum leire. So next slide will be why we are doing breast cancer awareness and how does it start. See, breast cancer awareness month kamaina start to kimna wari ma something lijage. The event was started in 1985 khar kuire matamam da National Breast Cancer Awareness Month haina si United States kini. So the lepiba first lady si America gi President Gerald Ford ki wife. She was a breast cancer patient. Ma breast cancer naba. She was a breast cancer patient. She has underwent surgery. Magi mana khanjaba. She thought that there are many patients. There are many people suffering from breast cancer. There are many people dying from breast cancer. Then she need to start some awareness. She need to start some program for their country. It was in collaboration with American Cancer Society and pharma company Imperial Chemical to fight against breast cancer by using mammography screening to 1985 tagi. So what are the goals of when a breast cancer awareness to bagi kana ba kaino? What are the aims and objective of awareness month? Breast cancer awareness kaino tham chum na tawi. Number 1, to raise the awareness about breast cancer. Breast cancer has educate to biba. Expert mayam educate to biba. Matungda tabi diba singdana. The listeners should educate other. Matang cheno na pigi bako. Aduna ay nang si mayam pami audience da ay khangja bakra haidisi mayam na muk magi sagi friend families puna maktasu educate to biba. Takpi ho. This is how breast cancer awareness. Hojukti social media sam thoe. Social media ki thura sudum post tong na bayai. Then promote early detection. Ngan na khangdok paje promotion to. So we have aim to promote early detection We have a scheme in our hospital also, so I will come in the frequent later slide. Then to support those who are affected, narabasing support of you, kamaina emotionally and financially support of you, and to raise funds, fund research the breast cancer have a treatment research out the then prevention ngaktok na bazu koina tigadabani amosung treatment so koi makha taba advanced treatment so koina tijangadabni. So this year 2023 the breast cancer awareness month, the theme is Tribe 365. Habadi survivors sing 365 days in a year say hing hanba phajana lahen nongai lahenba. So this is the theme that survivors should thrive well, happy, and in a good lifestyle, the 365 days in a year. This is the motto of 2023. And how we can participate? Kamaina participate OBI, not only doctors kitang nate, everyone can participate. Which the female students karui, mohojudum, high mayam participate OBI. Takpiba ang sahibido. To educate your friends, your sisters, your family members to how to do breast self-examination. Ay takchirake. Then number 2 is clinical examination. Clinical examination, habina doctor na check to biba. Then mammography, X-ray makalamani. Then you can donate some funds to the cancer survivors. Participate in fundraisers. Then wear pink. That's why I'm wearing pink today, just to support the breast cancer survivors and share information. Masi mayam fang information si wahay no eragasu social media do eragasu kitang share to bigo. This is how we can participate breast cancer awareness month. Then why awareness is important? Number 1 out of 8 women phamiba nupi nipan manung da amadi breast cancer nagni habasi. This is the hashtag breast cancer. In Instagram na sum thokne si mayam ko. My lifetime da nupi nipan manung da amadi breast cancer nagni. This is the estimate by the global expert. Then every 50 second minute amagi manung da somewhere in the world si koina mayam meeting toring mafam si matam si dasu mafam amadadi breast cancer ki patient ama si da bane. Then hashtag breast cancer. The third hashtag is the most commonly diagnosed cancer among the globe. Quite diagnosed to breast makhalangi cancer and breast cancer. The good point is 23% of the breast cancer can be prevented. Kamaina by early detection and other preventive methods. Not only bad news, we have some good news that 23% of the breast cancer can be prevented. So I will just come to in the next slide. Then the third thing, hashtag breast cancer, there is a disproportionation. Habis chana dabo. Naba machine sa haja badini. Naba machine tu yami, shiva machine tu yambo. Adona incidence is high, mortality is high in low and middle income countries because we have lots of issues. Since 1980, there are 40% reduction in the high income country. Mohoi breast cancer is handare high income country because of this awareness program as well as preventive strategy. Adon akoi Manipur da awareness program si phajana fulfill tawde and hygiening. Not only Manipur, India ki state amada suni. No makitang tawra to kiba. 1 month hai si akoi no makitang tawra si. Atopa mafam da sudum tawgadabne naina hai thamjani. So next slide, akoi breast cancer is community. What is breast cancer? Breast cancer occurs kamai thokono breast ki cell nupa du breast yawi adubu magi function like tabana almost breast tissue yam yaude du nupi da woman da breast cells yam yawi makoi je mutate tawba habadi changes lakba due to some risk factor mai kara takcharake mathangi slide ta due to the mutation the cancer becomes abnormal makoi je changes lai they become multiply macha pokthorok mathang then they form a tumor adon lump or cancer form. This is what, in a simple term, how breast cancer and what is breast cancer. So, I know typically affect the woman, but in males, no parus nabiai, but it's very rare, only 0.5 to 1% nabiai. So, how do you know that breast cancer symptoms, breast cancer ki alarming signs. This picture is a very simple picture, you can easily understand. This is the alarming signs and symptoms of breast cancer, but not all these symptoms are breast cancer. Hairibasi laire haidana breast cancer ni haibdi natte adubu si kitang chingnaba mayam ni ko. Aduna yamna su panic oibiganu adu, but this is to educate, just to give awareness mayam da thamjage. Nipple changes, nipple discharge, nipple je hong magi nipple je, the female nipple is projected tumthoga lagani, but if it is inverted changjan gi bataragadi or chekhar pataragadi, this is one of the alarming sign. Aduna tumtho amadagi changjan gi ba retraction of nipple, aduna koi nipple changes kawi. Then discharge haibada koi milk discharge nataba sangom thokku nataba bloody discharge, iru gumba I machum tarakpa breast ki khomjindagi ko. Then this is an alarming sign. Mathang da khwaidi common dum thengnaba nupina lump haibadi swelling apomba atangba breast da apomba atangba thengnaba si breast cancer da khwaidi common oiba khwaidi toina thengnaganba symptoms amni si adum isana feel to basu yai aduga khoi doctor yang kana khangbasu yawi. Adigi breast ki color changes tawkiba magi skin je overlying skin ji ngangsalakpa komla machu dongna komla imaku machu dong onsalakpa lerega chu, this is an alarming sign of breast cancer. Adu skin pitting tawba mohut kutpa ngasai komla gi khoina maku je thekchalakanda mohut dimpling the dimpling of orange, we call it purely orange. This is also an alarming sign of breast cancer. And naba pain, breast pain, but not all breast pain are breast cancer. Simaya am khangbiu nupi amagi life da definitely you will have breast pain, especially during the periods or after the period. The breast pain laibasi, this is not a breast cancer, but if it is occurring frequently, to ina naraba nangi thagi period lakpaga mari lenadabi da sunaraba, then it is something that different. Especially koi postmenopausal tha khongkap lep khraba nupi da breast pain naragadi, this is very alarming because mokhoi da di breast function tawdrabani adu matamna naragadi, this is very alarming. Aduna koi isagi ima iche hingda sumaina naba leragadi expert ka tanaba phai haibasima haijaningi. Dainang sa haijabado risk factor khara khangmina si risk factors I divide into two, ani thona khaidok chai, amana modifiable amana non modifiable. Non modifiable habadi we cannot change, that is see female gender. Once you are born as a female, you will remain female adum oiran he changed over here. Then old age sahi yam salakan, you will become older and older every year, you cannot change this. Genetic mutation, jindagi shorakpa, this is an error in the genetic level, you cannot change. Family history, you cannot change the family history. Early menarche, nganna period lakpa, you cannot change that. Late menopause, you cannot change that. Then dense breast, masakra chawba sa noiba haitare ko, breast dense oiba si change to yade. Then previous history of breast cancer, hana cancer nagi base nagrabni na mu change to diaro. Then third thing last haitare ko, radiation p previous history of radiation. Suma ma'am see, these are non modifiable, but I want to highlight on this modifiable risk factor because we can change. Because non modifiable we cannot change, but modifiable habiti when it's changed so risk factor ma'am see, we can reduce it, we can make it zero by doing good exercise. So obesity is a risk factor for breast cancer. We should control an ideal weight maintain over. Smoking, we should quit smoking. Alcohol, we should reduce or limit alcohol, we should stop alcohol. Hormone replacement therapy, infertility treatment or something hormone replaced oversea, yam justified or in a sinagadabni, then yamna hena sinabiade. Junk food as a hijagre, when oily, fatty food, fiber fat, mayam see them breast cancer gi respectively, then sedentary lifestyle. So this is the 25 to 23% that we can reduce by modifying this risk factor. Sigi risk factor mayam see when hantalagadi we can reduce breast cancer by 23%. This is what we mean. Again the same thing. So I have an arrow Above the arrow, these are all non-modifiable. Below the arrow, these are all modifiable. One more point, breastfeeding, angang mabuk pitakpa, mamana angang mabuk pitakpa is a breast cancer is reduced the whole man, it prevents breast cancer. It is a protective factor ne kanai. Aduna matam nowadays even the women are so busy in their work life, so they don't have a time to breastfeed their child. So this is the risk factor. This is another changing trend. So but we should breastfeed. Breastfeeding for 6 months is a very protective factor for breast cancer. Then giving birth nganna angang pokpiba sahi thiengna pokpanataba early birth haitare say 30s ki swaida angang first child birth lehba this is also a preventive factor aduna ajikti thiengna yum panare nowadays people are getting married after 35 36, so this is a risk factor. So thiengna yum panba risk factor mo oi. Then having no child angang poktaba this is risk factor mo, because this is a very scientifically proven risk protective factor, because when you are pregnant, when you are breastfeeding, there will be no mens later. There will be no mens for that period. That means the hormone remains stable. If you are not breastfeeding, if you are not pregnant, then you will have a monthly menstrual cycle which have a fluctuation of the hormone, estrogen, progesterone. So this disturbs the breast cells. So this is how the breast cell becomes muted. Toina up down changes like breast cancer all level. The preventive method is breastfeeding, early childbirth. Then also exercise, maintain health, good health, and alcohol should be reduced. So regarding the prevention, I divide into two types of prevention: primary prevention and secondary prevention. Primary prevention, lifestyle, and chemo prevention. We have some kind of chemo prevention. When a chemo prevention and breast cancer risk labor, high risk patient that we give some preventive chemotherapy. We can do prophylactic surgeries. Breast cancer, narani hana, we can do some surgeries to prevent the breast cancer. And secondary prevention is by screening and early detection. So I'll just come to the next slide. What is in my domain is the prophylactic mastectomy. So I think everyone, I'm very famous Hollywood star Angelina Jolie is the benchmark of prophylactic mastectomy and oophorectomy. She was detected with BRCA gene mutation. This is a gene which causes breast cancer in a woman, also ovary cancer. She was detected this gene mutation, so she was bold enough. Film star ni, but she underwent mastectomy. My skin sparing mastectomy. Skin di thamaga breast cell thokiba. Then do an implant, maintaining her cosmesis. But the other advantage is she don't have a breast tissue, so she will never suffer from breast cancer. Also, she removed her ovaries. So this is very good, and this is the benchmark. This is the Angelina Jolie effect. Yam taunare. Even in India, this is Times of India. That one lady from Kolkata, she also did the same thing. She tests for BRCA because she has a family history of breast cancer in her family members. She was tested BRCA testing, and when she was found positive, she underwent this prophylactic mastectomy and prophylactic oophorectomy. BRCA testing is not very costly. Hospital, we have BRCA testing in a hospital. If anyone of non have a family history, you can come down and consult with us. BRCA test this is a blood test. This is a blood test, we can do it, and once it is negative, you can stay free, and once it is positive, we can do some prophylaxis, prevention. So coming to screening, what is screening? Screening means it is screened in the asymptomatic. Kemta nada mida test of the screening kawi. Nada mi to screening kawi. This is to detect for early breast cancer. Normal population. So nada mi anybody that when a screen to especially to detect for early breast cancer. How can we do the screening? Number one, breast self-examination. Ishan ishabu ishagi breast examine tawjaba. Then clinical breast examination. This is done by doctors. Then mammography is an X-ray, which can do for screening, and MRI breast in some selective cases. Have you seen MRI breast is very costly, and it should be done only in selective cases. Doctor hanganga tagodam isan MRI tawjage na chatpa phatte because interpretation soiragadi wrong information lakani. Aduna high risk cases habadi sai family history laiba, genetic mutation laiba sukumbasida koin MRI tawi. Breast self-examination. This is self-examination start when the lady has just crossed around 20 years. My teenager helakanda test masan examine tawjaba. Yam scientific proven benefit later, but still is good. Quite scientific proven library. The next two is the clinical breast examination done by physician or trained healthcare workers, can be done in every 3 years. This is for normal person. So but if you are symptomatic, you should come immediately. Don't wait for the 3 years. You should come immediately. Don't wait for 3 years if you have symptoms. Ayang sa haijakiba warning sign mayam do leragadi sahi ngai da bida dum lakpe. Then mammographic screening. This ideally indicated annually. Sahi khuding amurak when the lady is above 40 years. My menopause loisalakpagi yaksalkumatang swaida when screening sahi khuding amurak tawye. But high mayam si the scenario is different in Manipur. Manipur ringamde because we have problems. As a hijagre types of breast cancer screening, population breast screening, sina universally national policy in a tamakanda yarakani. Opportunistic screening havena when a lady comes to a hospital for some other problem, maje gynae ki checkup lakpani khangti, antenatal checkup lakpani khangti, maje something problem lakpagi adada koina chance magi opportunity lahoba kudong chabal hoba to screen the breast for any breast lump or breast tissue or breast cancer. Then risk-based screening sa haijabudani sina moderate to high risk patient da koina risk-based screening khando ga mi pick up tawga screening. So breast self-examination and breast awareness, they are different. The difference is breast self-examination should be done regularly. Tha kudingi tagodamni, monthly kudingi tagodamni, by the masamasan by self. And awareness is an education. See the breast awareness ka breast self-examination kena awana education ni aman examination. This should be aware throughout the life. This is a very important picture. This is how a lady can do breast self-examination. When she just crossed 20 years, this is what she is doing on this side. She is marking a date. Mana numidam fixed tawni. Ideally, should be checked after your periods. Period loiba 7 days or 10 days marakta. Adi period tawringa nadi breast am tender oi or period mamang breast tender oi. Aduna breast examination tawu nungaira. Aduna after 7 days or 10 days of your menstrual period, record a date in your diary or a calendar and do every month. How to do it? You can stand in front of a mirror, raise your arms, both arms, and see is there any skin changes, color changes, any difference in both the breasts. Then level yengba, look for any physical changes. Level of the nipple levels left and right is the same level, or any bulging pomthokpa bumps level yengba. Adagi this is look. Have a first is look, then feel. Now we have to feel. Kamana feel tawni thiengaga. So right breast will be filled by left hand, and the opposite will be by the opposite hand. You can lie down or stand. Bathroom da tawbay or bedroom da tawbay. Aduna this is to be examined in the round starting from the nipple and going round and round towards the periphery. Mayai de horaga matai sakkiba. The left up, right up, feel taw. Kana namana taw. Just feel tawraga apomba thengna brani yengjaba. Can be done lying down or standing also. Or check tawraga ishana record tawa. This month I don't have any lump, I don't have any problem. Record it, do it the next month again. Then what are the guidelines? Guidelines kekele. The karam kan screening tawni. Screening should be start from age of 40. 40 mathak tagi. Then this is average risk habadi risk am laitaba mi kangbugini aduga say 45 helaba matamdana then we do annual mammography. Then 55 and above transition to mammography with depending upon your preference. Adi mammography to matamda sum torokta gadi even we can change the frequency of mammography habane eko. So these are different guidelines. I will not go in details of this. Masing singje lamamaga magi guidelines kenai adubu India masung khoi Manipur ki setup tadi khoi na say 45 50 se dum sanna bayaraba sahini for starting of breast cancer screening. And this is for the high risk tana sahi ngan hawi and sa jabduni as of 20. If you have family history and ishagi ima or back pomina iche ichanda breast cancer na age balai ragadi you have to start early. So don't wait for 45, you start as of 25. MRI to or mammography to So clinical breast examination, this is done by a trained expert. It's a very low cost, pisasang de annually above 40 years and sahajabuduni or every year, every 3 years for 30 to 60 frequency on high risk patient. Sahi yam gera yam moira risk le regadi khartoina togani 6 monthly torkani. This is very suitable for India. India ki damak yam chani because we don't have so much resource, so much manpower and facility to do the screening. So this is the facility what in India is commonly used for screening is the mammography. This started in 1950s, way back. Am kuire horpa. Dubu koi Manipur dagati amna name na tauri ay haijage. Only screening method widely tested and validated. Kwai degi kanaraba masung makes magi validation fangaba by sensitivity wangaba screening tool lamani. It can reduce the breast cancer by detecting early. Ngan na kondok po na breast cancer ki mortality is 15 to 20%. This reduce the mortality. So American Cancer Society na annually sa about 40 years the mammography to. What is mammography? Mammography is an X-ray. It's done in the X-ray room in a privacy. The breast is put in between the two plates of mammography plate. The breast is squeezed from top to down and from left to right also and take 2 pictures. But this should not be done in young women. Yamna nahaw ibra tawya de and dense breast tawya because it is painful. Laduna khoina doctor ga tanaraga mammography tawya ya de have su hang mam dakata because si chahi yamba musung dense breast di kitang feasible oidaba. So Indian scenario, breast cancer screening in the large population such as India is having a unique challenge because there are variation in cancer burden, cancer risks, and care delivery practice. There are challenges, and we don't have a very unique cancer policy in all over India. Then we don't have a trained pathologist, trained radiologist to do mammography, poor infrastructures, and expertise in providing evidence-based treatment. Expertise what? So come to Manipur. We have around 17 lakhs of women. And we have only 3 mammography. Lakh taraga taret lay koi nupi Manipur da. Adu mammography machine di hong kok lay. American Oncology da ama, Babina Diagnostic da ama, CJ da ama. So this is very disproportionate. Chana de haba. Aduna koi da. This is the challenges ne koi da lay. Mammography is late. Manipur da hong kok lay only 3 mammography. One in Babina Diagnostic and one in American Oncology, another in CJ Hospital. But how we can screen 17 lakhs? 17 lakhs is koi na kamay screen down. That's why breast cancer awareness is important. Koi na aware oy ragadi. Knowledge khar lay screen to bangam du. Masay isan haijabado. Self examine to biba. Adagi masay warning sign do lay ragadi. Doctor da la aga tanabiyay heavily. So these are the conclusion from the Indian scenario. This is almost a repetitive slide. So result indicates that clinical examination conducted every 2 years by primary health workers significantly stays down the breast cancer diagnosis. Aduna India dadi mammography machine what panina you should be examined by a trained physician and screened out. Also resulted in a non-significant 15% in the breast cancer mortality when physical examination tawbadagi risks amasung early detection tawbadagi mortality handhanma ngami by 15%, 20% ngamdragasu at least 15% ni ngamme Indian trials na utpada. But no significant reduction in mortality seen in women younger less than 50 years. Sahi karna ubadari karang watli because social stigma laibadagi thorak taba masung mayam laibanena. So clinical breast examination should be considered for breast cancer screening in low and middle income country and a high level. This is the Indian policy because mammography availability is not completely available throughout the country. So breast cancer screening, Indian breast cancer incidence increasing, the highly curable in if you're diagnosed in stage 1 and stage 2, almost 95%. These are the preventive lifestyle modification, genetic testing. These are all the new upcoming breast cancer prevention program, breast cancer screening, awareness, and clinical examination in high risk mammography. These are the Indian scenario. India the high is minor high taba. Lifestyle change to biba, genetic testing to biba, high risk patient the mammography to ba, aduga sumnagi low risk amasung average risk na clinical examination to biba. So this is the graph of breast cancer survival. If we can see stage 1 and stage 2, the survival curve is in the upper hand. When you are in stage 3 and stage 4, the survival curve is less. If you detect early in stage 1 and stage 2, the cure is almost 95%. So just want to conclude with few lines. Breast cancer burden is on a rising trend in our state. Koi Manipur dasu yamna masing wangkhalakpa mo oiri, especially even in a young woman, say 30s, 40s dasu breast cancer lakwa yam toina thengnajai. Aduga most of them come in very late stage. Nungaitabana moising theng lai habadi ikai bagi pinungi anabani na haidukpa ikai ba. They feel shy, they feel scared of the stigma. Then they feel scared, phobia, they will do biopsy. Number 1, clarify to biopsy doesn't spread cancer, especially in breast cancer. Yetum thilagadi breast cancer spread togani haidan losalaga thamba. Masai khoi honorable bishina jhabiramba. This is not time for quacks nadi. Don't touch na hairam gani. But when you come to doctor with expertise, we have to diagnose, we have to confirm. Confirm by doing tests. Assumption we should not assume and treat. We should confirm and treat. Importance of breast cancer awareness and early detection is very important. So I request everyone this month, please give this message to all your friends, families, and you're known through any method by social media or by conversation. Give the information about the importance of breast cancer awareness. Because breast cancer, a preventive method has a very important impact in survival. Prevention to we have a chances of 20% to prevent breast cancer by modifying those risk factors. Breast cancer has a high potential cure of rate anxiety if you treat it early, and we need to support the breast cancer survivors. So we have a very comprehensive package in our hospital, American Oncology Hospital, just for screening, even for male as well as female. I'm not good in marketing, but just say this is the entire list of the tests for screening for cancer in women as well as male, and this comes in a very affordable price tag. So I think people of Manipur should take this opportunity and screen out themselves. So this is a cancer survivor. She is a pop song singer. She was diagnosed breast cancer and she was treated in early stage, and now she is continuing her professional life as beautiful as before. So thank you very much for all your support. Any questions and doubts, please free to interact. Hangningba, or understand tawdaba leiragsu adum hangbi yani local dialect ta torsu kachu kaide. Some question or chudum hangbi yani mic lairadi. Any question, please? I welcome any question and even suggestion also. Question later, na log jara ke Yeah, okay. Okay, mic to.
Hello. I kind of risico. I know the quick cancer in Adragadi, we have some fun and later Nico. Adana, you Matang Changa, you know the park in Natragasu family Kiko, I you mother lady, I you sister lady, with the talk the Nabako, I you question them Tang Hanjag. Sounding as I shati Matang high give it up. Quick hormone replacement therapy.
Yes.
After menopausal co. Sarsi is a hormone replacement therapy. Estrogen na drug progesterone tawraga lying there is
hormone replacement therapy is usually done for postmenopausal problems. Menopause la matung da problem yam thokpagi estrogen musung progesterone haiba hormone sinaraga replace tawi. Madu sinabasi yam justified oina sinagadaba haibadi gynecologist ama tanaraga risk playable oragadi yaragi sinaroidabni, because these are the hormone responsible for breast cancer. Estrogen is responsible for breast cancer. Aduna ani maksi sinamatamda yamna justified oina sinagadab haitare. Si loynamak gynecologist ama tanaraga aina engonda risk labra leitabra ai breast cancer legadra leiroidra habasi tanaraga tawgadaba ai menopause legra ai hormone chaninge ai hakchang khongya sai ai saru sonthai ai humang anapi kange na ta chasan manataba tanaraga it should be as justified replacement. Aduna is hygienic risk to hantan baya heba.
Thank you, sir.
Ozai khangjaning wama leba question amtang hangi akhoi breast cancer je nawa haure khalaseba nawa horpo je haureba matam jida di akhoi je khanghaudreba ayamna cancer je thena khangma ngata neba ado akhoina haureba matam dudagi hauraga tha kyamuki manungda khanghauraga di hadi time limitation do leibra si phaugi manungda di akhoi sarnanga sai haibigiba 20% kanbanga meka haibudo adumaina adu phaugi manungda akhoi khangagadi leiba adugumba time duration ama khangning bai da du si phaugi da si dagi henjangraga di time je kitang dangerous oire kolle adumba do kitang thambiun
yam ngai je e khumjage ngasagi time duration je once diagnosed toba once khangibadagi or chingnarakpadagi treatment should be start within 4 weeks. Diagnosed torakana khange hairakanda akoina treatment si 4 weeks ta tawba manungda ko thengthadaba sima yam important ni aduga ngasagi hairiba question si ayamana cancer 99 de se khangdi pomaga or ngoitaraga lochalaga lei adu akoina sometimes kitang thengna khangaga su magi breast cancer si amaga manade. We have different classification, we have different grade nemba grade wangba adagidi cancer gi biology khena ba matungina there are some cancer very aggressive 6 months ta am spread torom sulai khara cancer khara na 6 months manung bokta am kana spread torom da sulai aduna masagi hai ba question do thengna report tawraga su akoina cancer biology ji khangaga di cancer biology da akoina khara khaidok chai yam technical ore na ine hapsadabani akoina grade 1 adagi di magi HER2 positive ER positive kain lai adu oitarga di makoi che adum low risk adum thamba yai adu ngasagi magi cure ki chances si akoina stage tor matung da cancer je diagnose tor matung da akoina staging tawi habidi kadai bok sandu ena breast dang lai ribra armpit segak long no chalabra saru de yorabra haidana akoina staging test kartawi CT scan gumba PET scan gumba adu stage 1 da leramba cancer ga sine akoina kitang thengna khangaga su stage 1 still leramaga di masagi mai cure dum wangi aduga nganna khangaga su magi cancer do yamna aggressive oramba cancer oram tadi yam thuna stage lansalami adum da ora kana treatment ji kitang why papta bire ko thank you adi mayam question okay thank you
Sir, working women gum the breastfeeding to sir ngasai risk factor the how high give do breastfeeding to the base adum khara prone oi kholena adu do breastfeeding to the twin pregnancy gum the oi bada angang sum bottle fit oina sir ani dugi kano to gi bagi anam oina to bangam hogda base ahoi adum chatlaga to thok screening to thok na phabra sir breastfeeding sum to hogda ba hai tare adum
yes adu my answer will be yes definitely breastfeeding sungtong tawdaba lady oiragadi at least clinical examination ama x-ray taw mammography tawdrabokta koina screening koina sai haiba Indian scenario de am chanaba clinical examination by trained physician amana check tawthokpodam fai adu yamna kanani na khale
thank you sir
makha tab question leitragadi I will take the permission to close my session.
Sir, if a woman has diagnosed breast cancer in her early stage of her life, so it affects to have a baby or affects her fertility.
Okay, that is a very interesting question. Yamna kanaba ne khale I kumjage if a lady is diagnosed breast cancer and what is her future in fertility amachung childbirth habani yes breast cancer patient can become pregnant they can even give birth akoi hospital lo breast cancer patient treatment tawkhre angang ju pokre aduga still ma yam nongai na leiri aduna there is no contraindication angang pokpa yade have laiti adubu doctor na there will be a time frame once you start treatment there will be some time frame that you should not get pregnant when treatment hogram matam marak khradi nang akoina pregnant oibiganu haidana concept to hobiganu haina akoina advice bijagani once that time frame is crossed you can become pregnant and you can give childbirth understand yare ko yani dum phamak hangbir suka sukai de
and sir if she undergone a surgery means breast cancer surgery so still she need to continue radiation therapy and chemotherapy
there are many surgeries that we don't need even radiation also there are some surgeries of breast cancer that you need radiation. We have two types of breast cancer surgeries broadly. One is mastectomy, remove the breast cancer. Another is breast conservation surgery. Breast conservation surgery means we don't remove the entire breast. We take out the tumor, maintain the breast cosmesis or figure. When we do breast conservation surgery, you always need a radiation. And the breast conservation tawki haragadi radiation darkar tai. Mastectomy tawragadi breast conservation tawuna tabnina radiation si even omit to VI, but depends on the staging. Then about chemotherapy, masagi tumor biology in hijabado that depends upon the tumor biology where you need chemotherapy or not. So not all breast cancer requires chemotherapy. Number one. loinamak mayam na kiresi chemotherapy toroga sam ki ne ba ki bale. There are many drugs, there are many medicine right now that some of these cancer drugs doesn't cause hair fall. Some can daba na pit thok tabu sulai aduga breast cancer patient khodi mak chemotherapy pini have sin natte. According to the stage, according to the tumor biology. Thank you. I take the permission to come down and close the session.
So early diagnosis of cancer generally increase the chance for successful treatment. So the only person who can help you is you. So either yourself or the society. So Thagachiri, Dr. Danavi Thangzang, Consultant Surgical Oncology, AOI Babina Specialty Hospital, Marik Chumlaba, Minakung Ogidaba, Karamna, Kamdauna, Kamaina, Breast Cancer, Gingar Horakpa, Ngakthoknaba, Giwarol Kayama Thambirambagi Damakta. Now may I invite Gopen Trongbam, Marketing Manager, AOI Babina Specialty Hospital, to deliver a speech and a presentation.
Ahanbada Timbiriba Mayambo Koknona Kurumjari University Asigi VC Dean Madam Pinky Amasong Sadanave Marik Sumo Fonga Tambirame Amasong MUSU Student Association Gi Mayambusu Aina Koknon Kurumjari American Oncology Institute Babina Specialty Hospital Mayamsu Babina Cancer Hospital Hairagadi Hena Kangnaba Hospital Asigi mayamna mafam khang muziaram gani khang da muziaram gani ai koi marketing team gi site gi ai matik macham tang thamjaram ge aduga mayam gi kana basingna karino ai ngasi gi khudong chaba breast cancer awareness gi khudong chaba si lauraga ai thamjaram ge hogdring aida ai small yam minute ahum gi video clip macham tang ucha ge sarnadi ngasai breast cancer gi matang da yam phajana marik chomo fam mayam thambirame early detection tawbagi matang da adagi kamaina treatment chathabagi matang da ai hospital koi gi American Oncology gi hospital se koi sajiwa khabai soi koi gi jail lairi du ge nakan dane lairi se hospital asi koina mayam ma introduce tawjari se kaino habada koi Manipur gi ai gi family ju mangai mapan da chalaga hena phagadra koi gi standard hena moina hena mapan chalas moi yam na le moina phajai haba mayam gi thinking am su mayam leiba treatment gi matang da nasai sir dinna takpiram do ai gi family da sumaina tawe sir kanona su vc nu su takpiram do ai gi family da sumaina tawe na haba ai hospital gi clip macham tang hanu chage Huzikito koi American Oncology koi Babina specialty ki koi cancer ki hospital specially dedicated for the cancer patients jingi damakta dedicated or hospital ne koi khabai soi sajiwa jail road koi lamlong dagi just another 2-3 minutes muktang chatlaga lairabane makata rakpada hospital asina piriba facility amasung mayamgi kana gadaba mongda ai kitang ai haijage hospital asida koi medical oncology aibadi koi chemo kapagi doctor special ai soiba koi DM medical oncologist leje surgical oncology koi Dhanavir radiation oncology da nuclear medicine koi Manipur da laitaba department nuclear medicine ngasai takpi hiba Manipur da ni di cancer ne na chalaga mapan yorgan cancer oiram di na takpi rise mase koi nuclear medicine je koi hujik Manipur da su yang wat na koi hujik nuclear medicine je only koi hujik American Oncology Institute ka tang ne belais ato from the late sisina magi backbone oi base cancer je khangdok pagi matang da ai horen mathang slide ta lak jage aduga atai koi medicine adagi surgery koi specialty loina starting from koi radiation oncology da Dr. Tomcha Dhaneshwar Sharma radiation de lay aduga medical oncologist da koi Dr. Sivasis Bhattacharya aduga hemato oncology da Dr. Sonamani amasung surgical oncology ngasi breast cancer ki matang de awareness pv ki ba Dhanavir Thangjam he is one of the very young and very dynamic surgery koi Tata Medical Center de gisu kano to birakpa doctor ne aduna yamna surgical oncology ki kano da hiram da magi topic ta yamna Manipur gi oina jam chokthok chaninga ba doctor amane Dr. Dhaneshwar Naurem koi head and neck ki oba tonganba oncology doctor le aduga medicine da Dr. Taruni Dr. Neha Thangjam koi mayamna su khangbiram bai Dr. Maxon General Surgery da aduga Dr. Nongthon amasung Dr. Nabachandra Orthopedic and Pediatric tasle sai aina hapet panjagi ba nuclear medicine is masida koi PET CT haidana sigi scan taunaba cancer je ma je detection tawda yamna maru oiba pot se half of the magi cancer treatment ro kan ma younglen saru haitare ne machine je iman ni manaraga Manipur da si je ahan bo idine koi sida leiri je atopa mafam da je northeast ta Nagaland da su leite neighboring state ta aduga Mizoram leite aduga sumnakanda koi Myanmar koi nearby areas like up to Mandalay Ubuk Saibuk area da leitaba koi PET CT machine si sina tawri je ayamba koi ki cancer je detection part ta oina kano tawba aduga maje cancer je nare na khangta su karamba stage ta nari no haidu my staging lep ase maje second stage third stage fourth stage ta nari ne haidu si khangdu ne sina aduga patient je hoje radiation tawre na traga chemo kape patient je manung da chemo kapa manung anabs de manung de maje pharabar fatabra magi koina kapi ba chemo je maje effective oibra oidabra haiba je sigi machine lepe PET CT machine ayamba si Manipur da leitringai dadi mapalam da si dangi oina te thatru khudingi test tawraga taw chanarame aduga very hara costly su yam oiba enone test amani si ai mathang da muglak sake koigi Manipur da ahan install tawjabane Linek Halcyon machine na si radiation da IMRT IGRT 3D CRT SBRT SRS koi palliative therapy na radiation therapy koi mayam na mai ai ba na hainabs cancer je nare matung na mai ai ba na hainabs da koi na angang uri ngai dagi uzari je pura kathi aga moina marking tawrga tawlerame ba hujik ta anoba da Halcyon Linek kai je kamaina tholi no haiba matam da sina targeted therapy oisale ba ai sigi mafam lungs tam fam ama nare ana mafam dang radiation phange ba kan magi atopa organ damage to 100 aduga mai ai ba matam da only 2 minutes 3 minutes katang change adagi patient jingda yang wadana khotana tawdo adumasu tawdra aduna sisu Manipur da ahan bo idune koi gi Linek Halcyon machine koi Tata Mumbai da lari se sidagi koi sisina latest version ne koi sida lari se Halcyon E na magi version quite latest so yudane aduna any Tata da hojik patient ning lai basing adum moi Tata gi doctors ne su adum moi mai ai bagi da makta dino sida am queen layer no Manipur da chalaga yai ro no dama patient mai am la ga su dum ana taweba ꯃꯊꯪꯗ ꯒꯃꯥ ꯀꯦꯃꯦꯔꯥ ꯍꯥꯏꯅ ꯃꯦꯆꯤꯟ ꯑꯃꯒ ꯂꯩ ꯁꯤꯁꯨ ꯃꯅꯤꯄꯨꯔꯗ ꯑꯍꯥꯟꯕꯅꯦ ꯑꯇꯣꯞꯄ ꯅꯥꯏꯕꯔꯤꯡ ꯁ꯭ꯇꯦꯠꯁꯤꯡꯗꯁꯨ ꯂꯩꯇꯕ ꯁꯤꯁꯦ DTP ꯑꯩꯈꯣꯏꯒꯤ DTP ꯍꯥꯏꯅ ꯑꯩꯈꯣꯏ ꯑꯉꯥꯡꯁꯤꯡ ꯀꯩꯅꯣ ꯇꯧꯔꯀꯥꯟꯗ ꯀꯞꯄ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯄꯥꯟ ꯊꯣꯛꯄ ꯃꯇꯝꯗ ꯀꯞꯄ ꯈꯣꯠꯄ ꯃꯥꯏ ꯀꯤꯗꯅꯤꯁꯤꯗ ꯐꯨꯟꯕ ꯈꯣꯠꯄ ꯑꯩꯈꯣꯏꯒꯤ ꯕꯣꯟ ꯁ꯭ꯀꯦꯟ EC ꯁ꯭ꯀꯦꯟ ꯀꯥꯏꯅ ꯑꯅꯧꯕ ꯑꯃ ꯑꯇꯣꯞꯄ ꯑꯃꯅ ꯑꯩꯈꯣꯏ ꯔꯦꯗꯤꯑꯣ ꯑꯦꯛꯇꯤቭ ट्रैकिंग है मी मसाजे मनुंग रेडियो एक्टिव यावब्रा यावदब्रा येंब खोटपगी गमा कैमरा है ना अमले असी आई होरेन मथंगी स्लाइड आई कोरिलेट तौजरके अदुगा कोई ट्रीटमेंट जे मेचिन जे मयाम दी लेरे अदुगा कोई पेशेंट जिंग जे कमाइना कोई ना ट्रीटमेंट तौरके हाबा मतमदा कोई जे इंटरन कोई ट्यूमर बोर्ड ले जाएबा डॉक्टर कोई सर्जिकल ऑन्कोलॉजी मेडिकल कोई डॉक्टर लेबा डॉक्टर मैम से पुलअप फम कांदा इंटरनेशनल ट्यूमर बोर्ड है कोई सिदा याम एडवांटेजेस अतोपा फम दगी कोई ना कदोबगी एडवांटेजेस लेदिनो हाबा मतमदा इंटरनेशनल ट्यूमर बोर्ड सिदा कोई USA की डॉक्टर सिंग यावनी को लाइव वीडियो सेशन ने बसिजे सिदा कोई केस प्रेजेंटेशन डॉक्टर सिना थागलानी अदुगा मोई सजेशन जो लोगनी कोई ना सी स्माइनर ट्रीटमेंट चाहता है मोई ना सजेस्ट तौरकने अदुदी इट्स अ कंबाइंड ट्रीटमेंट फॉर up to we are maintaining the कोई world level standard high standard तो कोई maintain तो जाए है बतो कोई tumor board ही ना तुम मैं अमरकता तुम any यूनिबिनिंग बल इतार से तुम लाख पे आगने अदुगा national tumor board कोई ले अदुगा internal tumor board कोई डॉक्टर मैं patient खुदी मुकी pull up खाना रगा कमाइना लायेंग गदगे है बतो अदु कोई hospital American oncology कोई Babina specialty hospital ले सकते हैं लायेंग दी मयाम ले रहे अदुगा याम लुरिसे कोई कैंसर बु नारदी लौ हिंगोन योलो हाइबगी अमा लेको मयाम जे वखलोन ने अदुना कोइना सम केसलेस ट्रीटमेंट कोई एम्पेनल मयाम तौरे अबजिक कमाइन तौदना पेशेंट जिंगसिगी हेन मतिंग पांगदगी हाइबदो आई सीदा हाइजगे कोई हुजिक हुजिक कोई केसलेस ट्रीटमेंट ओरसे CMST कोई हक्सेल की तेंगबांग कोई चीफ मिनिस्टर हक्सेल की तेंगबांग से मलेरे कोई आयुष्मान भारत PMJY कार्ड होल्डर जिंगना कोई ट्रीटमेंट फंगिबे अदुगा मणिपुर सरकार की थबक तौबा अमसुंग प्राइवेट हेल्थ इंश्योरेंसिंग की कार्ड पाइबा जिंगना मागी फैमिली जिंगना अदुम फ्री ट्रीटमेंट तौबगी खुदोंग चाबदमा कोई हॉस्पिटल असिदगी फंगिगनी मणिपुर की सिनेरियो तदी अयाम्बा युमथोंग से खुदिंग कोई CMST कार्ड से पाइबा अदुम थेंगनजै कोई PMJY पाइबा सु अदुम थेंगनजै अमसुंग मणिपुर के सरकार की थबक तौबसिंग मोय पाइबा यादबसिंग सु कोइना ट्रीटमेंट तौब मतमदा मोय की कार्ड सिंग सिजनबगी कोई खुदोंग चाबा अमा पिजरिगो पेट सिटी आइन अहान बदंग ngasai मेचिन अमा कोई अहान बुचगिबा पेट सिटी मेचिन जे सिदा टेस्ट तौबसे पेशेंट अमदा 25000 लवे अदो मी अमदा टेस्ट अमा तौजे लिसिंग कुन मंगा की टेस्ट नायबा मतमदा पैसा पाइबो ओइसनो लाइरबो ओइसनो मनिंग बैकिंग अदुम हल्ले सिजे ngasai की याम कनजरजु पोतुने याम तांगुनिना ngamaktaba matang yam yawebo अनौबदा सी कोई CMST कोई हंगंदक का ngasi का थारगा कोई हफ्ता अमदा अनिरक तौजाय कोई लेव पोकपका ट्यूसडे एंड फ्राइडे कोई तौजाय अदुगा सिजे if CMST नत्रगा PMJY कार्ड होल्डर होतादि मसे कोई फ्री ट्रीटमेंट तौवेबा अदुना एनी पेशेंट जिंग यमथंगना बदा नत्रगा खंगना चाना बदा लेबसिंग दो अदम सुमाइना कार्ड पुक पाइ तारदी नो ट्रीटमेंट तौवा आइदर विद केमोथेरापी होतारजु सर्जरी होतारजु रेडिएशन तौबदा होतारजु नत्रगा मसा सोंदना हॉस्पिटलाइजेशन तौबदा ओइबा तारगसु कोई CMST नत्रगा PMJY कार्ड होल्डर ओइबिबा तारबा अदुइतादि फ्री ट्रीटमेंट तौबगी खुदोंग चाबदो कोई हॉस्पिटल्स ने पिजरी अदुना मोइदा हाइबीबा मीजिंग नोइगी नियर एंड डियर्स नोइन हाइबीबगी दमक्ता महै फंगबमा हाइबदो ओइबियु हाइबगी आई अदुमसु आई हाइजगे अदुगा मणिपुर स्टेट गवर्नमेंट की थबक तौबसिंग दिसु कोई तोंगान मोइगी रीइन्वेस्टमेंट की खुतांगदसु दुमाइना एना तौवे हेदि रेडिएशन थेरापी से लुपा अइना खनबदा अराउंड लुपा लाख अमा मखाइदगी हौरगा लुपा लाख अहुम मखाइ मरी बु यौ यादो असागी कार्ड चिन्ह तौरगा अदुम सिनबा याबगी खुदोंग चाबदो दुम फंगै कोई अदु उजिक अपकमिंग द करी लाके मणिपुर द कई वाल हौरिगे ना सुम नैनबा मतमदा अनौबदा सिजे हंदक बाय द एंड ऑफ दिस मंथ नत्रगा मथंग थागे हौगलकपा कोई सिदा आयोडीन थेरापी ना कोई थायराइड कैंसर है ना मणिपुर द याम नारिसे नोमदा थायराइड कैंसर जे डिटेक्शन जे कोई बबिना डायग्नोस्टिक तगी मोइदे ताकपिरक मतुंग इनदी नोमदा मी अमदगिना अहुम बुकसे दुम नाय हाय याम वांगबर रेट ने थायराइड कैंसर की sida koi iodine therapy sima koi sida hodore by next month da sigi protocol yamna change kaino radioactive material ngatang lakpani na sisemaga aduga koi blood cancer da bone marrow transplant aina koi amaga koi yama sembadi lore aduga hodi hodri ko sima any combining ba laitara in future da koi Facebook ta dum ayamba any koi contact numbers yawza bane hojik matam de ayamba Facebook Instagram pai bi bane na mayam dum follows to bio hojikan di dum updates any requirement natraga khangning ba natraga job opportunity oi tara su koi da loina update tawe aduga mogi di aduni adane haiba koi kemle jade all same moina koi Babina specialty hospital gi maikaidagi sim request tawjage mayamna dum khangbining ba laitara ju anytime koi phone number sidi yawjabane yawbane adu mayamna dum call tawbiro loisalakpada health package sama ngasai sir na ju slide tadi utpigre koi sigi test mayam se tawba matamda ayamba cancer gi test ne aduga koi sida medical oncology surgical oncology any other koi doctor consult tawbagi ju pulap hapsan jaraga koina paisa je apit kya mukta gana lupa lising nipan taret nipan muksai gi range ta leire ba sije ayamba sije koina public ta hujiki oina koina breast cancer awareness gi oina pula punjala koina nupa gi chahi je magi yankhai gi makha da waragana lupa lising ani ga chatre yankhai de pi bane aduga nupi gi oiragana chamane lising ani ga chatre yankhai da aduga if nupa da chahi yankhala agana chahi mathak yankhai gi mathak waragana lising hum ga chani yankhai da tumai pi jabane sigi matang da aina si pujari te ai kenom koi Manipur University gi oina koi student jingi odagi oza jingi koi CGA oza jingi de yamba aina khanja bada koi CGA rate ki makharam da oina ayamba leram gada khalle adu student jingi oina ya fana bagi da ai anoba package sama subsidize over ya package sama da ase including asai the nupi jingi da yam kana jik sarna ngasai takpi ki ba koi ki mammogram dus de yaudine include tawdine sida aduga nupi singde yamna ngasi khudong sa bhe logdaraga koi ke pap smear koi woman nupi singde koi cervical cancer Manipur da su yam number 2 da lei be sim su koi include tawraga ai package sama madam Pinky gi through da I sinjarake aduga mayam gi kanaba su lobiyu haibaduma ai adumaga thamjage losalokpada thank you so much koi Manipur University gi koi satra singi association gi ai hanana thagachari koi American oncology ki in future adum any kanogumba lakpa matamda adum tathok tasin tawna se koi adum koi matam chupada student association bu su koi thonglaw na hangna thamjari oja sing bu su amasung madam Pinky especially thank you very much for giving of this opportunity for us to highlight us for our what we have in American oncology and in our Babina specialty hospital. I see harga matang solutions again. Thank you so much.
ꯑꯩꯈꯣꯏꯒꯤ ꯃꯅꯤꯄꯨꯔ ꯁ꯭ꯇꯦꯠ ꯑꯁꯤꯗꯁꯨ ꯑꯦꯃꯦꯔꯤꯀꯟ ꯑꯣꯟꯀꯣꯂꯣꯖꯤ ꯏꯟꯁꯇꯤꯇ꯭ꯌꯨꯠ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯑꯃ ꯂꯤꯡꯈꯠꯂꯛꯄꯁꯤꯗ ꯌꯥꯝꯅ ꯅꯨꯡꯉꯥꯏꯕ ꯐꯥꯎꯖꯩ ꯑꯃꯁꯨꯡ ꯃꯐꯝ ꯑꯁꯤꯗ ꯂꯥꯌꯦꯡꯗꯨꯅ ꯑꯩꯒꯤ ꯏꯃꯥ ꯏꯄꯥ ꯏꯆꯤꯜ ꯏꯅꯥꯎ ꯁꯥꯒꯩ ꯅꯥꯇꯩ ꯃꯔꯨꯞ ꯃꯄꯥꯡ ꯄꯨꯝꯅꯃꯛ ꯀꯦꯟꯁꯔ ꯍꯥꯏꯕ ꯂꯩꯅꯥ ꯑꯁꯤꯗꯒꯤ ꯐꯗꯨꯅ ꯇꯥꯏꯕꯪꯄꯥꯟ ꯑꯁꯤꯗ ꯀꯨꯏꯅ ꯄꯨꯟꯁꯤꯕ ꯑꯣꯏꯁꯅꯨ. Now to deliver the vote of thanks, may I request Halishan Ngainthim, Social and Culture Secretary, Manipur University Student Union, 2022-2023.
Good afternoon. Ngashiki akhoi one day academic discourse akhoi MUSU 2022-23 amadi akhoi AOI Babina Specialty Hospital amasung akhoi Manipur University gi Health Center hoi Madam Pinky punna sanction minaduna sinjar langjari ba akhoi one day academic discourse asi mapung phahan bigiba maru oina akhoi dais ki phampham langda phambigi ba dignitaries sing mingoina panjarabada chief guest ki phampham langda phamgi ki ba akhoi Professor N Lokendra Singh Honorable Vice Chancellor Manipur University anisubada guest of honor gi phamplang da phambi gi ba Professor M Premjit Singh, Deans of Students Welfare, amadi guest of honor lang gi phambam da phambi gi ba Dr. Lamabam Pinky, Medical Officer, Manipur University Health Center, amasung ngasigi akhoi yamna dukumlaba mayamda wakhal losing oiba amadi awareness pibi gidamakta daita lobigiba guest of honor gi famfam lang ju fambigiba akhoi mingoina panjarabada Dr. Dhanabir Thangjam, Consultant Surgical Oncology, AOI Babina Specialty Hospital busu hanna thagatpa phongtokpaga loinana kai khumna bochari aduga ngasigi das ki akhoi ngasigi thoram sigi President ki famfam lang da fambigiba MUSU ki President TS Sonamni Singh busu hainingai leitana thagatpa phongtokchari aduga masida natana ngasigi thoram masibu hena mapung phan bibagi damakta lakpigiba akhoi gi tongan ba akhoi gi oja sing amadi akhoi gi Babina Specialty Hospital AOI gi akhoi gi staff sing akhoi gi AOI ki akhoi gi marketing manager sing pumnamupu thagachaba phongdokchari aduga loisilakpada akhoi gi ngasigi asigulba awareness program asigi kanaba lahongna baidamakta lakpiriba akhoi gi chhatra sing busu akhoi gi MUSU gi organizing committee gi maikai thagatpa phongtokpaga loinana akhoi gi press media akhoi gi kumhei.com busu asigi thorum sibu akhoi gi video recording tawdona YouTube ta phanghan bigani haina lakpiri basu akhoi thagatpaga phongtokchabaga loinana thorum sibu loisin jabagi ayabat lojaraga ofam sing asi tentakna thamjari. Thank you.
Once again, on behalf of the Manipur University Student Union, AOI Babina Specialty Hospital and the Health Center Manipur University, I would like to thank you who had spared your precious and valuable time and cooperated to make today's event a grand success. So with the permission from the President, we have to come to the end of the function. So stay healthy, stay safe. Punamapu Thagachari Khurumjari.